All right, we're gonna go. Good. All right. So good afternoon and welcome to the voting list number 4 for the Health and Government Operations Committee. This is Friday, February 23rd, 2024. We have 4, let's see, 1, 2, 3, 4, 5. All right. Are there any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, thank you. They're withdrawn. And thank you everyone for a hard week of bills and everything you're doing, all the meetings you're attending. I am really grateful. We have the first bill we're gonna vote on is House Bill 103. The sponsor is Delegate Bagnall. It is the Maryland Medical Assistance Program Dental Services Coverage and Rate Study. It was voted out of subcommittee favorable. The analyst is Aaron and the chair is Bagnall. Aaron.
This bill requires the Maryland Department of Health to study the feasibility of including coverage with minimal benefit restrictions for removable full and partial dentures and reimbursement for providers on a per patient basis for house calls and extended care facility calls under the Maryland Healthy Smiles Dental Program. MDH must also study the feasibility of setting reimbursement rates for such services at certain amounts.
Bagnall.
This was non-controversial. It was unanimous. I would move the bill.
Second. It's been moved and second. Any discussion on the bill? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none is unanimous. House Bill 127, Public Health, Non-Occupational Post-Exposure Prophylaxis, NPEP. It was favorable with amendment out of the subcommittee. The analyst is Aaron and the chair Bagnall. Aaron.
This bill establishes a non-occupational post-exposure prophylaxis standing order program. The program must authorize a licensed pharmacist who is registered with the program to dispense NPEP under specified circumstances. The Maryland Department of Health may administer the program, collect fees, establish guidelines for conducting patient education and training, and collect and report data on the program. There are amendments in your packet that strike language that would have authorized a licensed healthcare provider with prescribing authority to prescribe and dispense NPEP through a standing order that requires MDH to adopt regulations that address the needs of specific populations using the program, including victims of sexual assault. The amendments exempt certain individuals from being charged fees and require the clinical criteria for the program to be consistent with the most recent CDC guidelines. The amendments also strike language that would have authorized the delegation of dispensing authority to employees of public or private entities.
Bagnall.
Thank you, Madam Chair. We had a really good discussion on this. The amendments addressed outstanding concerns from MCASA and also a concern about scope issue. I would move the amendments.
Second. It's been moved in second. Any discussion or concern from the committee? Seeing none, all those in favor of the amendment say aye. Aye. Any opposition? Seeing none on the bill as amended. Is there a motion? It's been moved in second. Is there concern or discussion from anyone? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none is unanimous. The next bill is a departmental bill. The next one, House Bill 146, Health Occupations Board, Reciprocal Licensure and Certification. It is favorable with amendment. It is Lisa and Rosenberg. Lisa is on Zoom. 1 second, please. And thank you for being patient as we wait. While we get Lisa, let's go on to House Bill 152, Delegate Boyce, Department of the Environment Study in Death Care and Funeral Practices. It was voted favorable. It is Lindsay and Rosenberg. Lindsay.
This bill requires the Maryland Department of the Environment, in consultation with the Department of Health and Department of Labor, to conduct a study of the impacts of death care and funeral practices on the environment and public health of the state. The study must examine the environmental and public health impacts of casket and vault burial, mausoleum burial, casket-only burial, natural or green burial, cremation, alkaline hydrolysis or water cremation, resomation or natural water cremation, and natural organic reduction. MDE may consult trade groups or organizations and academic institutions to complete the study, and MDE must report its findings and recommendations to the Governor and General Assembly by October 1st, 2025.
Rosenberg.
Madam Chair, this legislation passed this committee and the House last year and died on the Senate floor. So I would move the favorable.
Is we moved in second. Any concerns from anyone here? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none, the bill passes unanimous. We have House Bill 177, Delegate Lewis, Hospital Care of Infants After Discharge. It was favorable with amendment. Aaron, and then Delegate Bagno.
This bill requires a hospital prior to discharge after the birth of an infant to provide oral and written educational resources to an infant's parent or legal guardian on how to provide a safe sleep environment. Before discharging an infant, a hospital must ask the infant's parent or guardian to describe the sleep environment in the home and inform the parent or guardian of the importance of a safe sleep environment and document that the educational resources were provided, and have each parent and legal guardian sign a form confirming they understand the instructions and information provided. There are amendments that strike certain specific requirements to be included in the educational resources, replace references to instructions with oral and written educational resources, and require on or before January 1st, 2025, each hospital to establish a certain process for providing the educational resources and for the parent or guardian to confirm receipt of the resources.
Okay, Bagno.
Thank you, Madam Chair. This was a huge collaborative effort by Delegate Lewis. The amendment addressed outstanding concerns, and it was passed unanimously. I would move the amendments.
Second.
Is there a discussion on the amendment or concerns? Seeing none, all those in favor of the amendment say aye.
Aye.
Any opposition to the amendment? On the bill as amended, is there a motion? Is been moved in second. Any concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none is unanimous. On House. Oh, co-sponsor, does anyone not want to be on that bill? Okay. The bill is actually 177. Oh, no, I'm sorry. It was 177. Sorry, I was right. 177. Does anyone not want to be on that bill? Delegate Riley? Okay. House Bill 215, Human Services Attendant Care Program, ongoing additional supports. It is favorable. It is Aaron and Bagno. Aaron.
This bill expands the purpose of the attendant care program in the Maryland Department of Disabilities to include providing financial assistance to an eligible individual for ongoing additional supports.
All right, Bagno.
Thank you, Madam Chair. Everybody loved this bill, and it passed unanimously. I would move the bill.
All right. Is removed in second. Any concerns about the bill or discussion? All those in favor say aye. Any opposition? Seeing none, the bill passes unanimous. We're gonna go back to Lisa now. So we're gonna go to, if I may, and thank you guys for being patient. Page 1, House Bill 146, Health Occupations Board Reciprocal Licensure and Certification. It was voted favorable with amendment out of the subcommittee. Lisa and Rosenberg. Lisa.
This is a departmental bill that authorizes any health occupations board that does not otherwise have statutory authority to do so to adopt regulations establishing reciprocity for individuals who are licensed or certified in another state that also offers similar reciprocity to individuals licensed or certified by the board. There is an amendment on page 7 that strikes the words "or jurisdiction."
All right, Rosenberg.
Thank you, Madam Chair. The amendment is technical in nature. This was 3 opposed, all the rest in support. And it deals with reciprocity, authority for regulations to establish reciprocity. We've already moved the reciprocity bill out of the committee, so it would move and the amendments first.
The amendments have been moved in second. Are there any questions about the amendments from anyone? Delegate Hill.
I just had a quick note that there was, I don't see it in the testimony, but that there was a dental amendment. Was there a discussion about a dentist? It's not in the testimony.
Lisa, oh,
Yes, so the Dan Doherty with the Maryland State Dental Association, had an amendment that was discussed, but no one moved the amendment.
All right, thank you.
Okay, good question. Delegate Riley, I saw you coming.
Yeah, no,
It's
thank you,
okay.
Madam Chair. So that's the reason why I had voted against it, because it was kind of confusing because in his testimony, he was favorable, but then he came up with amendment after finding some additional information, the lobbyist Daniel. And then so he contacted the board, but I know in the subcommittee, they still were, it is true, they're still at a disagreement and the amendment was not taken. Is that correct? Yeah,
Yes,
It's not offered. No member of the subcommittee.
right.
I think
Okay.
the feeling was should be taken up as separate legislation next year.
Okay. Is it true then, without his amendment, it only allows those folks in the compact to come to Maryland and practice, but they can't, but the Maryland physicians, or what, I forget, we have so many compacts, they can't go out to other states.
No, the heart of every compact is the reciprocity. That if you are a Maryland physician or whatever the nurse, whatever the category is, that you can be certified in the other state and people from the other state can be certified here.
But that was his issue. He was saying the way that it was currently written, that the folks that here in Maryland could not practice in the other states, but they could come here.
I'll defer to
and
council,
practice.
but I don't think
Okay,
that's the case.
okay.
So my understanding is that the dental board already has a reciprocity set up. And so this bill doesn't directly even affect that. I think that was why the amendment ultimately was not moved by anyone, because they thought it was a separate issue. I don't think this bill affects any compacts that are in it. It would just allow boards that don't have reciprocity, which is different from compacts, to set up a regulatory system by adopting regs to have their own reciprocity.
Delegate, 1 second, Delegate Riley, do you have any more questions? Okay, Hill.
That's just for closure, could you just remind me of what it was that the dental amendment, I understand it wasn't taken up, but I'd like to know what the amendment was.
And then I know I see Shalega and Chisholm. Thank you for your patience. See anyone else?
So the amendment would have, in the dental statute, it would have required, so like I said, they are already a dentist a dentist licensed in any other state shall be issued a license in this state if they've passed the exam and everything. What the amendment would do was require the other state to offer similar reciprocity to Maryland dentists. So that's not something that's in our current.
Right. And if I understand correctly, reciprocity agreements are exactly that. You can't have a reciprocity agreement unless both parties agree to do the same thing.
That's what the bill is.
Right.
For all of the boards that don't already have something in their statute, yes, that's what the bill says.
Right.
But because the dental board already has language in their statute around this issue, the bill would not apply to them. Does that make
Thank you.
sense?
Yeah, thank you.
Delegate Shalega, followed by Chisholm.
Thank you. So I'm just a little confused because we've had these reciprocity bills for like nursing but then is this just like a blanket, the rest of you do it?
It
Why-
allows them. It doesn't require anyone to do anything, but it would allow the boards. that
So why
don't
did we
already-
pass the other ones? Why did we do it like this one, that one, and not?
The compact. And
So,
this
but-
authorizes them to do it in other,
Okay, so the
Aspect.
groups that didn't come before us now won't have to come before us. Is that what this bill says? So then, like in the nursing comp.
May I ask a clarifying question for that one?
Okay,
To follow yours, if it's okay?
yes, please.
So because you trigger something in me. So the ones we pass, they came to us and we say, yes, we'll allow it. This one, we'll leave it up to the boards to decide whether they would do it. Is that the difference?
To the ones that don't already have it in their
Yes.
statutes, they could decide if they wanted to, in regulations, set up reciprocity with other states that have it. So the bill would require them to have, to allow Maryland residents, so the reciprocity, and it also requires there to be a determination of whether they're similar. So there are other statutes that we've already passed and one we're about to get to as well that may have different requirements. And I mean, this bill only applies though to the boards that don't have any reciprocity in their statute.
So I'm
So
thinking,
one second, let Delegate Shalega, because she kindly let me,
thank you.
ask my question.
Thank you. So I'm thinking of this advanced nurse practitioner compact where we had opposition and last year it didn't pass. And we just voted it. I voted against it because the advanced nurse practitioners said no.
So
So-
the compacts are something completely different from the.
Okay, so the compact's not reciprocity, but
They're a separate licensure scheme. Lindsay had the nurse practitioner bill, so she can chime in. But those are separate from this reciprocity agreement.
And may I
They're-
let Lindsay chime in, Delegate
thank
Shalega?
you.
Is that
Yes,
okay? Go ahead,
please.
Lindsay. And thank you, Lisa.
Yeah, just for clarification, I mean, both compacts and reciprocity allow for out-of-state practitioners to practice in our state, but reciprocity is a one-on-one agreement with the other jurisdiction. So we want to enter into a reciprocity agreement with Virginia only. Compacts cover many states.
Thank you.
Thank you for the clarification, because I think we were all confused. Thank you. That helps, Delegate Chisholm and Delegate Chisholm.
Thank you, Madam Chair. And that's
You're
kind of what I was on, because I was, the APRNs, they kept, whenever they
Yeah.
contacted me, they said, we just want reciprocity. The compact's never going to work for us. So does this solve their problem, at least for each state that they're willing to, I guess, enter into that reciprocity with?
I mean, I don't want to speak for them as far as whether or not this would address, but to the extent that, yes, they'd prefer reciprocity, then this would allow for that. The compact is different, but again, reciprocity agreements need to be individually negotiated between the states. And that's why there's, I apologize, this isn't my bill, it's Lisa's, but there's language about the similarity and the qualifications and things like that, and the need to have that mutual reciprocity as opposed to just letting someone come into Maryland and not letting the Marylanders go to that state.
Right. So,
And-
but the genesis of the bill is to bring more workforce here easier or for, and vice versa.
Yeah,
Thank
and
you, Madam Chair.
thank you. And I know Delegate Rosenberg, then Hill, then the Vice Chair, okay?
Thank you, Madam Chair. I'll just add the compact bill passed the House last year. It did not pass the Senate. So this is the second year it's passed out of this committee. And now, well, it hasn't been in the House yet. This section, it has passed the House. And this bill now before us applies only to a health occupation board that does not otherwise have statutory authority to issue licenses or certifications under this article by reciprocity. That's what this bill is directed at.
All right, Delegate Hill.
Thank you, Madam Chair. I just want to, and Lindsay and Lisa can correct me. I think this may be clarifying. Reciprocity agreements, as Lindsay said, are one-on-one agreements between our state and other states, or from the boards of our state to another state, that says that if someone is licensed here, we respect, or they respect, that the qualifications are essentially similar to what they have in their state, and therefore that license they can be licensed in either state. And it's sort of a broad thing, right? So if the, the pipe fitter medical people have a reciprocity agreement, then it covers all the pipe fitter reciprocity agreements. I mean, anyone in Maryland can practice in Virginia or across the line in Delaware. The compacts are generally multi-state agreements where individuals from each state can apply through the compact to save themselves some of the work of applying to multiple different states for licensure. It is more individual, so it's a state agreement, but every individual kind of has to apply to know that they can, in some cases, you have to specify which states in the compact you actually want to practice in, but it sort of opens up a lot of doors. But it doesn't mean that every provider under that board in the state has the right to do that. They have to individually apply to the compact. Reciprocity says if you're, again, as a group, if all the dentists in Maryland individually want to apply, they can. There's no questioning because you have a Maryland license that's good enough for us. So it's one's more global in terms of the practitioners and one's more global in terms of where you're going to.
Delegate Shalega.
Thank
You're
you,
welcome.
Delegate Hill. That was helpful in clarifying. So if there is a reciprocity agreement between physicians in Maryland and physicians in Pennsylvania, you don't even need a compact. I didn't, that,
All you want to do is practice in Maryland, you
Right.
don't need it.
right.
But if you want to be able to have, in some cases, telemedicine, if you want to be able to have multiple locations and different things, it's just sometimes cheaper and faster not to have to go through the same background check, the same, review, the same everything that you would have to do in Maryland, then do it again in another state and pay money again, and do it in another state and pay money again.
So the more reciprocity we have, the better.
I think
See,
the
it sounds like for health professionals, because then you don't have to fool with all the compact applying here and, okay.
That's
Yeah,
right.
they're
Perfect.
individual decisions, but yes.
Yeah,
That's
thank
right.
you.
Vice Chair Collison.
Thank you, Madam Chair. And just to resolve the advanced practice nurse issue, they would prefer reciprocity over the compact because they're making the assumption that if Maryland engaged in a reciprocity agreement, they would only do it in states that gave them the full practice of authority that they have here in Maryland. That was their issue, that in other states under the compact, they wouldn't have full scope of authority that they have here in Maryland.
Okay. Any other, this is the place and I really appreciate it. So are there any other concerns or questions? Everyone feels comfortable with it? Okay. Were we on amendments? We were? We were, they move in second. Okay. Just move it again for sake. Move it. Second. Okay, they've been moved in second. Any questions or concern? Seeing none, all those in favor say aye. Any opposed? Seeing none, and the bill is amended. It's been moved in second. Any questions or concerns on the bill as amended? Seeing none, all those in favor say aye. Any opposition? All right, it's unanimous. Thank you. My brain froze a little bit there. Okay. Co-sponsor, let's see, it's a departmental bill, right? It is, so we can do it. But thank you for asking. That was a good one to be part of. We have next Lisa. Okay, should I do, oh no, it's 1 minute. Let's go to 380, sorry, 380. And that is Delegate Solomon, State Emergency Medical Services Board licenses and certificates. We did 215 already, didn't we?
Yes.
So I'm right, 380. Are you guys trying to trip me or what? Are we like, should I just go home? It's okay, let's go to House Bill 380. Delegate Solomon, State Emergency Medical Services Board, licenses and certificates, application requirements. It was favorable. It is Lindsay and Rosenberg. Lindsay.
This bill prohibits the State Emergency Medical Services Board from requiring as a condition for licensure or certification that an applicant provide proof of lawful presence in the United States or have a social security number or individual taxpayer identification number. The EMS board must require each applicant for license to either disclose their social security number, individual taxpayer identification number, or provide alternative documentation. That is for the purposes of child support enforcement. There are no amendments.
Okay. Yes.
This is similar to a bill we passed last year, and I'm sure you remember the testimony about this one individual who would be able to be a volunteer in Montgomery County with this legislation. So we move favorable.
Okay, and just to be clear, this only deals with that. There's nothing else in the bill. All right, so is there a motion? Is there a second? It's been moved and second. Is there concerns or questions? Okay, yes, Delegate Lewis.
Thank you, Madam Chair.
You're
I just
welcome.
wanted to say that this bill was a little bit confusing to me, but ultimately I understood that its purpose is to expand the number of volunteer firefighters in our state. And there is a shortage of volunteer firefighters in our state. This bill makes it possible for those holding I-10 numbers to serve as volunteers. And that seems like a something that's good for all of our jurisdiction. So I was comfortable voting yes on this bill.
Thank you. All right, Delegate Hill. Delegate Hill and then Chisholm. Okay,
Thank you. Can someone, just so there's clarity in when other people ask about the bill, because it talks about licensure and certification, and it doesn't say to volunteer versus being paid. Where is it that it's clear that it's about only volunteers?
Get confused because I'm
No,
confused.
you're not the only one that said it, and I
Okay.
think that's
can
fine.
we allow counsel to, she'll answer. Thank you for the question.
So the requirement is, or the prohibition rather, is on the EMS board for the purposes of licensure and certification. It doesn't change any requirements for somebody to be paid or not. So to the extent that you need to have an ITIN or a social security number in order to be paid, you would still need to have that. To the extent that it's a hiring requirement, you would still need to have it, but it's just for the purposes of the licensing or certification. Not this year, but when the bill was in last year, referring to the health occupations boards, there was some discussion about people pursuing these like employment and the license simultaneously. Maybe an employer could help sponsor you for your lawful presence, things like that. So rather than having to do this sequentially, you could pursue both at once, as long as it's not a barrier to your license or certification.
Thank you.
Thank you. Delegate Chisholm,
Thank you, Madam Chair.
you're welcome.
That, my question was just clarified, but now I'm a little confused by what Lindsay just said. So they are going through a sponsorship at the same time, or is that?
I'm sorry, not necessarily. It was just an example of why someone might want to be trying to get their license or certification at the same time that they're pursuing something else. Or if in the example case of the testimony that we heard that they're a volunteer, but if they were trying to pursue some sort of paid employment, that it, to the extent that they still need to have a social security number or an ITIN for that employment or to be paid, an option would be that they could pursue both at once rather than sequentially.
I got you. Okay. I'll just make a quick statement. I think that everybody in this room would hire that girl. And that doesn't mean that it still doesn't give me pause on a, she's obviously an outstanding citizen, outstanding person, and we need more people like her, but it still gives me pause because sometimes we can't see the other things coming down the road. Just wanted to put that on the record. Thank you.
And I appreciate you. I really do. No, it's okay. Thank you so much. Thank you. And I appreciate your comments. I really do. You know, like these are issues that honestly the federal government should be addressing. And then what happens is that the state, we have to lead on a lot of this because people are living here, right? They're volunteering, they're contributing, they're working.
And I hope and pray that one day the federal government gets their act together and does it. Okay? Anyway, I'm gonna get off that soapbox, is what they say in America. And let's take the vote. Any other discussion on it? But I do appreciate it because it makes sense. All right. Seeing no discussion, all those in favor say aye. Any opposition? Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Kip. Thank you. All right, so let's go, and thank you for the discussion. Let's go to House Bill 408, Delegate Bagno, Mental Health Law, County Mental Health Advisory Committee membership. It was voted favorable. The analyst is Aaron and Bagno. Aaron.
This bill adds an individual with experience with mental health care for veterans or individuals serving in the military to the list of persons that can be appointed as a voting member to a county mental health advisory committee.
Bagno.
Thank you, Madam Chair. We had a really good discussion about whether we needed to be more prescriptive. But with subsequent conversations with the Senate and Senate sponsor, and also looking at our local jurisdictions, we wanted to leave flexibility because we didn't want to be too prescriptive on the expertise. And I would move the bill.
Second.
It's been moved in second. Any concerns or discussion on this bill? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none is unanimous. Then we have House Bill 576. It's mental health emergency evaluation and involuntary admission procedures and assisted outpatient treatment program. It was voted favorable with amendment. The analyst was Aaron and the chair was Bagno. Aaron.
This bill requires a county to establish an assisted outpatient treatment program and establishes the criteria for and the structure of the program. The director of a specified mental health program or any individual who is at least 18 and has a legitimate interest in the welfare of the respondent may petition a circuit court for assisted outpatient treatment, also known as AOT. The respondent is entitled representation, including representation by the Office of the Public Defender for qualified respondents at all stages of the proceedings. If the court finds by clear and convincing evidence that the respondent meets the criteria for AOT, the court must order the respondent to comply with AOT for up to 1 year. By December 1st of each year, the Behavioral Health Administration must submit a specified report on each AOT program. The bill also authorizes psychiatric nurse practitioners to perform the examination of an emergency evaluee. The bill's provisions regarding emergency evaluees take effect July 1st, 2024, and provisions related to AOT take effect July 1st, 2025. There are amendments that were adopted in the Public Health and Minority Health Disparities Subcommittee that retain current law related to the transport of emergency evaluees and the requirement for MDH to admit emergency evaluees to an appropriate facility under certain circumstances. The amendments also alter the definitions of serious and persistent mental illness and treatment plan and require a county to establish an assisted outpatient treatment program on or before July 1st, 2026. The amendments alter the requirements under which the court may order the respondent to receive AOT, requires treatment plans to be recovery-oriented and consistent with evidence-based and evolving best practices in the treatment of serious and persistent mental illness. The amendments require a care coordination team to honor a respondent's mental health advance directive and allow a respondent to have an opportunity to voluntarily agree to the treatment plan. The amendments provide that the court does not need to hold a hearing when responding to a motion related to a material change to the treatment plan. The amendments strike language that would have authorized a court to consider failure to adhere to a treatment plan when determining whether the respondent meets the criteria for an emergency evaluation. The amendments strike language that would have authorized the care coordination team to petition the court to order an additional year of continued outpatient treatment at the expiration of an order, and instead requires the team to provide the respondent with a plan for continued treatment if considered necessary. The amendments expand the information to be included in the Behavioral Health Administration's annual report to the General Assembly to include information on the number of voluntary agreements made and certain de-identified demographic and results data.
Okay, Delegate Bagno.
Thank you, Madam Chair. This bill, as we all know, is the efforts of multi-meetings, work groups and stakeholders. We've had 3 subcommittees on this bill as amended, and The conversations were really good. We had one outstanding concern, which we are going to address, but I would move the amendments that the subcommittee moved.
Second. The amendments have been moved and second. Are there any discussions or concerns on these amendments that we just moved? Seeing none, all those in favor say aye. Aye. Any opposition to the amendments that were moved? Seeing none, all those in favor say aye. Any opposition? None. On the bill as amended. The bill has been moved as amended, okay? It's been moved and second. Are there any questions or concerns about the bill? Delegate Shalega.
Thank you, Madam Chair.
You're
What's the
welcome.
fiscal note now?
You want to address that? Thank you.
$3 million in the budget for this program. And actually, the fiscal note came in at way under 3 million.
Okay, so it'll be, that's good news. So is it an ongoing 3 million, or is it the program set up to continue being funded, or? You're gonna
So
have to-
Marie, you want to introduce yourself?
We know Marie.
So people out there know who she is.
Thanks. Delegate Schlega and I go way back to the Senate. We're here in the House now though, so it's great.
For the people out there, your name?
Sure. Marie Grant, Assistant Secretary for Health Policy. So there is $3 million in the budget for planning for fiscal year 25, which starts July 1.
Okay.
2024. Future like implementation will be in future fiscal years. And so there will be funding enough to support this program. This program's not going to work without appropriate funding. But to the chair's point, the expectation by the department, and we believe wholeheartedly that this is the case, that this is a money saver over time, that between lower Medicaid costs, lower hospital costs, it really is going to help save the state money over time by making sure that folks get treatment earlier in the process where they need it.
Thank you. Thank you for the question, Delegate. Delegate Morgan, followed by Chisholm.
Thank you, Madam Chair.
You're welcome.
Marie, what happens if a county, let's say you're a small county and you just can't afford it? What happens then?
So under the amendments that were adopted by the subcommittee, Delegate Morgan, counties can make partnerships. They're authorized to make partnerships. And so I think in the bill as introduced and under the subcommittee amendments, they would be able to establish partnerships. Like, for example, on the shore, the thought was that there would be multiple counties that could enter into partnerships there.
But in addition to that, we have an amendment that the department, if the counties don't, if I may, I apologize. I know I'm the chair, but I want to be respectful. There's an amendment that we're going to get to that we haven't gotten to, but it's a great question that actually says that if the counties are not able to do it because they can't afford it, they just have to notify the department so the department can do it. So that takes, that covers those counties that will have a problem. And thank you for the question, because that's important, right? We have 23 counties in Baltimore City, 24 different jurisdictions. So we want to be mindful of everyone. And we'll get to that amendment. Thank you, Delegate. That's a great question. Delegate Chisholm, followed by Hill.
Thank you, Madam Chair. When we were talking about this amendment, it was the judiciary had a little bit of concern with it, but I wanted to just make a remark that I did talk to Judge Morrissey after we were in subcommittee.
Yes.
And he says he still loves the bill. I mean, he'd take it a little bit better, but he's given it a 95% instead of 100%. So he's very happy. He knows he's got a chance to come back and make any changes that they might next year. But by the end of our work group, and I know that Tiffany and Heather and a lot of people did a lot of work on it, everybody seemed very happy. And most importantly, he feels like it's going to be a tremendous asset to the judicial. So I just wanted to make that statement.
And thank you, Delegate Chisholm. I have to tell you, I love our committee, and it's because of that. Okay, because you work and everyone cares and everyone works together, and we discussed it. So thank you for having that conversation with him. Delegate Hill.
Yeah, it's just technical in there, and I'm sorry I didn't come to you before here. On the reprint, page 18. in section 106A-02, line 9.
1 second while they look, while she looks.
So we're on the bill, page 7? Yeah. Okay, so I just wanted to be clear, clinically appropriate referred to the assertive community treatment services and not the peer, because in subcommittee we discussed that the peer services were always, so I'm looking at the wording, if I understood correctly, and I'm wondering if because of the and because of the sequencing, it looks like the clinically appropriate applies to both the assertive community treatment services and to the peer recovery, which we.
No, it would only apply to assertive communities.
Could it be clear if we just reverse that order?
You can always reverse the order if you want. It would have the same meaning, but
Okay,
if you're concerned that the if clinically appropriate would somehow attach to, we can certainly just change the
it's just a
order.
thought. I just,
Okay, it doesn't, but I can change the order.
if that's okay with the.
You can change it.
Okay.
All right, is that okay? We'll change it.
I think it would be, yeah. Thank you.
That's good. We'll do it. All right. This is the place. And when I say that, I mean it. Okay. Like, I'm not saying it just to say it. I want you to be comfortable. Okay. Everyone. And great suggestion. Any other questions or concern on that amendment? Right? All right. All those in favor say aye. Aye. Any opposition to that amendment? None. It passes. On the next one.
So there's a separate amendment, and this amendment is being offered by the department, but also chair is offering this amendment. Under the bill, counties do have to establish assisted outpatient treatment by July 1st, 2026. This amendment, if a county informs the department that they do not intend to establish an assisted outpatient treatment program by January 1st, 2025, that the department will establish the program in their county.
Okay. Delegate Hutchinson.
But I appreciate this amendment and thank you that those who brought it forth. But now that I've heard it described, is it covering the issue that I have? If the state is doing it and implementing it, and when the funding is no longer there, who's paying for it?
Go ahead, Marie.
Paying for it. So this is, this amendment represents a commitment that, again, I don't think that we heard from you, Delegate Hutchinson, some concerns about counties. I think we've heard from some other smaller counties in particular about concerns about implementation. And so what this represents then is the counties would notify us by January 1, 2025, if they intend to pursue that on their own or not. That gives the department time to establish programs in those counties that would choose not to. I think the department would establish it in a very similar way, right? Like when we're thinking about regional partnerships in those smaller counties, we'd look to take a regional approach across the state for those counties that would choose not to implement a program. But I think what this amendment does is really the department's commitment to this. We don't want to put something on a county that they do not want to do. And so that we would take that responsibility on if we don't hear from the counties that they would like to do it.
Okay. So no financial obligation to the counties that opt out.
Except to the extent that their circuit court costs go up. Although overall, again, we're hoping that balances out.
Understand.
Yep.
Thank you. Thank you, Madam Chair.
You're welcome, Delegate Riley.
Yes, so the bill doesn't address it. So with kind of the same question that Delegate Hutchins had, what stipulates a small county or a small jurisdiction? Because that's not actually in the bill. Is that something that we should have in the bill, or is that something you're going to set on your own as an agency?
So let me clarify this. So this amendment applies to any county. So it doesn't matter whether you're Montgomery, not picking on Montgomery, or you're, Somerset.
Okay, so it's not small or large, it's just
Yeah.
any county has. the
Any
option.
county can opt out.
And to opt out, what do they have to give the department? How do they prove the fact that they can't afford it or whatever the case may be, that they don't want to go forward with it?
So if I may, they don't have to prove anything. They
Okay.
just have to
Just
say, I want to
ask.
do it, I don't want to do it. And
Okay.
they have a year to do that by January 2025.
Okay.
Very simple.
And then if they do, say they feel like they want this program, then they do it. So the funding will come from the state, is what you said. And that'll go through the judiciary budget.
So
what I heard you
the
say?
funding is with, currently, right now, it's the Behavioral Health Administration and the department's budget.
Okay.
That's
All
as a health program.
Okay, so if do the counties have an option if they do move forward with it, like year after year, can they actually say, I want this amount of additional monies for their circuit court or our district court or for our budget to pay for this? Is that how they would do that to get the funding?
So for the future years, Delegate Riley, I think we're going to be working in really close collaboration with the counties and the LBHAs to really price out for future fiscal years, right? Because this is a planning year. Future fiscal years, what those costs would look like. And, it would still, everything would go through the same process that we all do every year with the governor's budget, but we'd be in close contact to understand.
So the counties would
costs.
be notified of approximately the amount that they're going to have to come up with that particular year to actually cover the program.
The hope is that we would support them in
Okay.
doing that.
Okay. All right. Thank you very much.
And for the record, for all of us, I think and I appreciate those questions, Delegate Riley. The department is really committed. This is not gonna work if they don't fund it. Okay, they're really committed. And I was tempted to get it in writing, but then I said, I'm gonna take their word, right? Because God willing, we'll be here, right? And we have this. This is as if we had it in writing, okay? So I trust the secretary. She's been great working with us. I know that, she put the $3 million in there. They're letting the counties get out if they want to. They have really given everything we have asked. They have said yes because they want to make it work. So I am really grateful. And those are great questions. But it's really, they've been great. It's really balanced. And I take your word because you had not only just words, it's action. You guys have really been working hard at this with everyone else. But these are great questions. Delegate Hill.
Thank you, Madam Chair.
You're
So
welcome.
I think for clarity for people who haven't worked the bill and are on the subcommittee, it would be helpful for either the subcommittee chair or the Deputy Secretary Grant to tell us about how many people we anticipate. It's not a large number being able to be covered under this.
Marie.
Happy to answer
Sure.
that.
Good question.
Yeah, it's a wonderful question. And I, we're never going to know for sure. Certainly based on overall New York numbers, once the program is fully implemented, based on those numbers, maybe 700. We did a run of a 36-month look back at folks who had been, I think, before OAH, involuntary commitment more than once, and it was about 560 folks, right? So that gives you a rough proxy of what this program will look like once it is fully operational, and that will take time too.
Sure.
Yeah.
Roughly 700 people who are hoping aren't going to be homeless on the street. 700 people who we're hoping aren't going to be called in a cyclical fashion or picked up by the police because of outbursts and cycled back through the emergency rooms and back through the psychiatric hospitals and then released and then cycled again. 700 people in a given year who will hopefully have the support they need to stay healthy and get back to functioning. Is that about right?
Exactly, Delegate Hill, and not come into contact with the criminal justice system for suffering from mental illness. Yes.
Thank you. Any other questions or concerns? This is the time.
Seeing none, all those in favor say aye. They've been moved and second, correct? I did move it? Okay, all right, all those is moved in second. We discussed it. All those in favor say aye. Aye. Any opposition? Seeing none, it passes. We have another amendment, correct? We're done? All right. So on the bill as amended. Moved by Delegate Kipke, second over here. Any questions or concern on the bill as amended? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none is unanimous. I do want to take a minute. First, I want to thank the department, the Secretary of Health, Marie, Jun Shang, all of you have been amazing in meeting with us. Like what the world has not seen are all the late meetings we have had in the conference room on Friday nights after everyone leaves, and the many calls and meetings in both chambers, right? Because we're also working the other chamber to make sure, God willing, that it passes. So I want to say thank you. And then I want to thank Delegate Bagnall and Delegate Olston, who have been working together beautifully on this bill. I want to thank you. And I want to thank the judiciary and everyone that has worked over the years on this bill. And Aaron for the many emails and calls as well. And I know the advocates, some of which, why don't you tell us your name? I know who you are, but the whole Western world doesn't know. Go ahead, Evelyn. Who has been working on it for many years, and Ms. Bennett and others, Nami, Dan Martin, everyone. And if I left someone out, I apologize, because it did take a village to get us here. This bill has not been able to pass. It passed last year, but before that for more than 24 years. The fact is that we're not going to be able to satisfy everyone, right? The ACLU will never be satisfied. The public defender will never be satisfied. But at the end of the day, does it help? And Evelyn, I know I spoke with you. I know you want more. But in order to pass a bill here, it's an art, and a delicate art, where you're not going to get everything, right? But hopefully it helps. And it does help those 700 or 500 people. Some of them, I heard about one, they had been to the courts 50 times, 50 times. And the many times they go to the ER as well. The money, the expense, but the human aspect of this as well, the suffering to the families. So this is really a good bill. And I hope, Evelyn, that you work it in the Senate, that it passes. Please, I'm begging. And begging is a big word, but I am begging those that say it doesn't go far enough to leave it alone, because this was such a delicate balance that if you pull this thread this way, it's going to unravel. And guess what? I will not take this bill up again next year. I will not. It will not pass, because I am not going to spend the energy and our staff to work on it. This is our opportunity to do it. And I cannot be any clearer than I am being right now. What is the phrase that says, don't let the perfect be the enemy of the good. This will help people. It will make a difference. Okay. Thank you so much, everyone, for working on it. And I want to thank the committee for working on this and for participating, every single one of you, on this. I really appreciate it. Delegate Hutchinson.
Thank you, Madam Chair. I want to thank the department. I want to thank Delegate Bagnall, the chair, for that I was listened to. And it taught me how working in the subcommittee and sharing the concerns of my constituents, my counties, and I think we came up with an excellent solution. Appreciate it very much.
And I thank you. And when I say I mean it, I want all your input, I mean it.
okay? Because it matters. You come here, all 22 of you are away from your homes, right? And your families, and it has to be worth it. Your voice has to be heard, okay? And I thank you, and this bill shows it. Delegate Bagno.
Thank you, Madam Chair. And I just wanted to say thank you to the committee, thank you to the subcommittee, and particularly thank you to the work group. Because we did a lot of work last year after crossover, but while we were still heading towards sine die, and that does not go unnoticed.
Can you
and
tell me who was
unrecognized.
on the work group? Refresh my memory, please.
It was Delegate Hutchinson, Delegate Hill, Delegate White Holland, Delegate Lopez. She's smiling because sometimes we weren't totally clear. Delegate Johnson, who was the sponsor of the bill.
Yes, and I was gonna
Delegate
get to him in a minute.
Alston, Delegate Martinez.
Thank you.
I've got everything.
And if I forget anyone, and Delegate Johnson, you know, when you introduce a bill right here, sometimes people are very, like my kids used to be, this is mine, right? You gave it up for the governor to take the bill, the administration, and you have worked hard on that bill. You had the courage to put it forward, but not everyone does that, okay? And I appreciate it, and that's why I respect you, and I want to thank you, okay? For doing that as well. Who does not want to be on this bill? All right, it's unanimous. Excuse me? No,
Actually, this one already had co-sponsors, so.
it had co-sponsors, so we could do it, okay?
You're already on it.
All right, so everyone wants to be on it.
To say I missed Delegate Kipke
All right.
when I was
Delegate
announcing
Kipke.
all of, and he was.
Thank you, Delegate Kipke. Okay, wonderful. Well, thank you, everyone, okay? At the end of the day, we all voted for it, so I'm very grateful. And the administration, thank you so much. Evelyn, you should be proud of you, okay? You did well. All right, so let's move on to House Bill 570, 628. Delegate Johnson, Health Occupations, Clinical Marriage and Family Therapist, Reciprocal Licensure Requirement. It was voted favorable out of the subcommittee. It was Lisa and Rosenberg. Lisa.
This bill requires the State Board of Professional Counselors and Therapists to waive the education experience and exam requirements for licensure as a clinical marriage and family therapist for an applicant that is licensed or certified to practice clinical marriage and family therapy in another state, territory, or jurisdiction. There were no amendments.
Delegate Rosenberg?
This is a bill that Delegate Johnson stuck with. And in gratitude, the waive is if there's a history of no history of disciplinary action and no act or commission that is grounds for dismissal or denial of the license, discipline or denial of the license, it was unanimous. Oh, no, there was one in opposition, but I think that's been removed.
Okay, so it was,
Favorable.
is there a second? It's been moved in second. Any discussion or concern from anyone? All those in favor say aye. Any opposition? See none, it's unanimous. Who does not want to be on the bill? Oh, it is favorable, sorry. I know it. Sorry. Wishful thinking. House Bill 755, Delegate Bandari. State Board of Social Worker Examiners, Board Membership and Certified Social Worker Licenses. It was favorable. Lisa and Rosenberg.
This bill alters the membership of the State Board of Social Work Examiners by authorizing the board to include at least one member who is either a licensed certified social worker or a licensed master social worker who is approved for independent practice. The bill also specifies that if a licensee of the specified license category is not appointed to the board within 3 months of a vacancy, a licensee of any license category must be appointed immediately if that licensee is otherwise qualified to be a member of the board. The bill also makes clarifying changes and removes obsolete references to certified social worker licenses, and there were no amendments.
Rosenberg.
It was unanimous favorable.
All right, you move it? Second, it's been moved in second. Any concerns or questions? All those in favor say aye. Any opposition? Seeing none, is unanimous. Let's go to House Bill 756, Delegates Hutchinson and Arlington, General Provision, State Flag Caskets of an Eligible Decedent. Go ahead. It's favorable with amendment. Lindsay and Kerr.
This bill requires the Secretary of State to furnish a state flag to drape the casket of an eligible decedent. After the burial of an eligible decedent, the state flag must be claimed by and provided to the eligible decedent's next of kin or provided to a close friend or an associate if not claimed by the next of kin. The bill specifies that only one state flag may be provided for the death of an eligible decedent. The Secretary of State may not procure any state flag as required under the bill unless it's wholly produced in the United States. However, the Secretary of State may waive the requirement if it cannot be met reasonably. There is a reprint of the bill on page 31 in your packet with amendments adopted in subcommittee that add the current or a former governor of the state to the definition of eligible decedent, specifies that the Secretary of State must furnish the flag on request, and requires the Secretary of State to develop a process to submit the request and verify the eligibility of the request.
All right, Delegate Kerr.
Thank you, Madam Chair.
You're welcome.
There was some discussion during the bill hearing about who is responsible for determining how this would be implemented and how the eligible people would be identified. You assigned some homework to Delegate Hutchinson. He was able to wrestle it away from his dog and turn it in on time. And that the resulting homework is the amendments that I will now move.
Wonderful. It's been moved in second. Any discussion on the amendments? Any concerns? All right, all those in favor say aye. Any opposition? Seeing none on the bill? Is it moved in second? Any discussion on the bill as amended? Seeing none, all those in favor say aye. Any opposition? Seeing none is unanimous. How about sponsor amendment? Who does not want to be on the bill? Everyone wants to be on your bill. Delegate Hutchinson, congratulations. So this actually concludes the the voting. However, I would like, if Delegate Woods will be so kind, if we can sing happy birthday to Aaron, whose birthday is tomorrow.